We need to have more of a holistic approach. I think that when we're looking at projects such as the Best Care for Older People, it really makes us stand back and go, oh wow, there's a person under all this. Under all this paperwork, there's a person, and all these little aspects of this person's care are all interlinked together. How this person walks, what this person eats, how this person goes to the toilet. They're all connected. They all make up the individual. So we need to make sure that when we are assessing, that we're assessing the individual, not just patient number, 356.
The earlier that you learn things, the sooner that you can start putting them into practice. And for student clinicians, the theory is put into practice quite often straight away. You're doing student placements all the time, and therefore, if you've got the knowledge of the toolkit already ingrained, then you're going to be able to put that into practice while you're a student, and therefore when you make the jump to being a professional, it's already there and you're already able to use it.
The patient has to be asked very clearly and get from them exactly what it is that they would like to get back to doing. If you can marry those two together, if the patient has a goal, it might be an unachievable goal at this stage. But if we ask them, then we can say, well, before we can get there, we will need to achieve this and this and this. So you set about enabling goals that you can get the patient to do. And if you're working towards the person-centred goal with your person-centred care, what a great marriage this would be.
Communication. I think that's the biggest thing, communication between everyone in the wards, the staff and the patients. Each section talk to each other, have a group session, and even bring the family involved, even a family grouping. Let them know that there is something there out for them to go home to. If they're not going home to their own home, to a nursing home. There is life that they might have to change, but there is something there for them. Don't just let them go and out the door and say bye.
And I think as a patient, a long-term patient, I see myself as part of that team too, because I'm there for them to work with. And if they communicate with me what they want, how I can help them help myself get better.
We don't want anyone to fall, we don't want anyone to choke. We don't want a lot of things to happen. So we tend not to, at times, let people stay as their normal functioning self. Sometimes empowering people goes against, what we've learnt and, the clinical checklists that we tick off each day. And, how do we deal with that as a group of individuals that working with someone when maybe their agenda's different to ours?
The breakfast groups that we have here are great, because the patients get out of their rooms, they go into the dining area, and the physios and the OTs are with them and they support them, but they can make their own coffee and tea and toast.
I encourage patients to express what they want to get out of the day. Quite often that will be, I've got family coming in at this time, I'd really like to go downstairs, is that okay with you? That's fine, we can make that happen. We'll work around that to give them that hour of family time. I certainly think is one of the things that we can do to put them at the centre of their care, and to make them feel like more of a person rather than just a patient.
Once I was listening to a patient calling out, and I was actually at the nurses' station and several other staff were around me complaining about the noise coming from that particular room. So I got up and went to see what the challenge was, and I said, why are you making such a loud noise? Why are you calling out so strongly? And she said, it's the only way that I get heard. And all she needed was to be repositioned, and she was comfortable and she could go on with her day. And so instead of it being about how it was affecting all of us sitting at the station, it should have been about her. That's why she was with us. And we just needed to put her back into the focus.
Clinicians, I would say, look for any opportunity that you can. A smile is a lovely start. People respond so much to that. A kind word. Being somebody who is likes to listen to a few words from you before they rush off to the next job.
When we can stop and prioritise what's important for our patients, then maybe we can change what we think's important. Or if we can talk to another colleague and say, look, I'm just really busy, I'm not going to get to this, this and this. Or even if it's just a this, get some help. And when we all do it together, when it's a group effort, when it's not just a medical process or a nursing, or we're not just doing physio, when we're all doing it together, we'll get there.
We all know that anyone that works in the healthcare profession, works really, really hard. There's no question about that. I think what we want is people to do things a little bit differently. We want people to take a slightly different approach when they're caring for people. And I think that word care is probably quite fundamental in what we're talking about. That hospital stay needs just to be it's a small part of their life. We need to keep it as that. We need to make sure that when they leave hospital, they go back to life, because that's the important part.
The sad fact remains that a lot of older people come into hospital, and whilst we're very good at treating the underlying medical condition, we're not terribly good at dealing with all the other things that happen to older people who are in hospital, and we call that functional decline. Older people are at risk of having another number of things happen to them in hospital. They can become confused, they may develop incontinence, their mobility may worsen, they may become depressed and anxious. And to date, we haven't been terribly good at actually treating that. We know it's the simple things that actually significantly improve the care of older people. Straightforward things such as the right environment for older people and also the right care. We know that a team-based approach to care is really important in the care of older people. Involving and listening to patients and their families and carers is so important. And there's the detail that we sometimes forget. It's whether the meal tray is in reach during mealtime, whether there's plenty of fluid available during the day to prevent dehydration. It's getting people out of bed and making sure they're kept ambulant and mobilising during the course of the day. It's making sure that we look out for the problems of depression and anxiety and actively manage those with the patient. It's about making sure we orientate people so they don't get more confused. The beauty of the toolkit is that it actually breaks down all the strategies that have evidence into manageable bites that clinicians can actually use to improve the care of older people. It is an absolute delight and pleasure looking after older people. What we actually need to do is arm people with the right skills and the right attitude to look after older people well. And this toolkit goes a long way to actually being able to provide people with the right set of strategies, the right set of clinical guidelines to help them do the best by their patients.